Department of Health and Human Services has announced a grant program for hospitals within the state that will expand access to crisis stabilization services.
This would include funds for hospitals to build specialized hospital-based emergency departments, as well as behavioral health observation units.
Our Samantha Popovic, she joins us live in downtown Charleston.
Samantha, can you tell us how this will change traditional protocol for emergency department care?
Good morning. This $35 million behavioral health crisis stabilization program will benefit patients experiencing behavioral health episodes, including mental health and substance abuse as well. The South Carolina Department of Health and Human Services says over the past few years, South Carolina has seen an increase in the number of people using emergency rooms to address a behavioral health crisis, whether that be substance or mental health. They say they have been looking closely at their behavioral health delivery system in the state and have seen it is fragmented. The South Carolina Department of Health and Human Services says they have made efforts over the past year. Those efforts came after they heard from the MUSC Pediatric Emergency Room that they were seeing 6 patients a day for behavioral health needs. They said they had partnered with the Department of Education in the last year in an effort to improve mental health counseling for students. The department found that children are 7 times more likely to access a behavioral health service if it is in their school than they are outside of school. South Carolina Department of Health and Human Services Director of Communications and Public Relations, Jeff Learitt, says the state is trying to facilitate a process within the emergency department that keeps emergency rooms open for patients experiencing acute illness and trauma. He says their overall goal is to have a triage center where patients can be stabilized within 24 hours so they can receive proper care for the first critical 72 hours. That has behavioral or mental health resources attached to it.
Emergency room is the most expensive place to treat somebody. We want to make sure that we're using emergency rooms for incidents that require that level of care. But we also want to make sure that if somebody's in a behavioral health crisis, that that we're able to appropriately triage them and link them to the right step down type of care.
Roper St. Francis Hospital psychiatrist Dr. Sarah Coker says this grant will change the traditional process of inpatient behavioral care, making it a quicker process for patients who are waiting for a hospital bed.
So if this grant goes to building more crisis stabilization type units where maybe it's a mix of observation, they're not sitting in an ER, they're still getting adequate attention care, but also not waiting for a bed at a psychiatric hospital, that can provide more access, more resources, better care.
The South Carolina Department of Health and Human Services says their goal is to have grant selections for selected hospitals by June of this year. They have not set a limit for funding being dispersed to these chosen hospitals. Reporting live in downtown Charleston, Samantha Popovic, Live 5 News.